Today I'm in Switzerland in the headquarters of Storz Medical, a leading company in the production of Shockwave's devices and systems. Just follow me. Hello, nice to meet you.
Welcome to Storz Medical.
I'm here with Mr. Alessandro Saccucci, that is the International Sales Director. So, to get started, let's first introduce your company, Storz Medical.
Sure. Storz Medical was founded in 1987. Indeed, we already are 35 years old. And we are a manufacturer of medical technology with 280 employees worldwide, located here on the Swiss shore of Lake Constance in Tägerwilen. And we specifically develop shockwave systems and shockwave devices of the highest precision. In this respect, quality and reliability want to be our claims to ourselves. Indeed, we proudly believe that we have been shaping a piece of medical progress in the service of therapeutic procedures, and we will keep on doing our best in the next future.
So I'm very curious now. Let's go?
Yeah, please, follow.
And now it's time to introduce also another very important person for our interview today, that is Dr. Dilana Hazerao. Welcome. Mr. Saccucci, in which medical fields is the shockwave therapy applied?
Well, the company's portfolio started in the 80s with products for non-invasive extracorporeal shockwave lithotripsy for the treatment of kidney stones. Our medical products in urology field already proven themselves with more than 2,000 installations worldwide. And the benefits of this non-invasive technology have been therefore extended to other medical disciplines. Today, Storz Medical is setting new standards in the treatment procedures with technical innovations and products to treat various conditions. For example, ischemic tissue of the heart, pulled muscles and tendons, and poorly healing wounds. So our products are applied in the field of orthopedics, urology, musculoskeletal disorders, dermatology, aesthetics medicine, cardiology, and even neurology. So we have around 50,000 shockwave devices manufactured and delivered so far, and we are present in more than 130 countries worldwide.
Among the Storz medical disciplines, you mentioned the neurology field, but for the treatment of neurological diseases?
Yeah, the principle of shockwave therapy has been used for more than 40 years already to treat various conditions, just as mentioned before. Simplified, can be said that the shockwave trigger a mechanical stimulus which leads to a biological response from the organism. So in the mid-90s, Storz Medical recognized the effectiveness of shockwaves for peripheral neurological diseases such as spastic movement disorders. The first treatments of patients with Alzheimer's dementia have been carried out in 2015 in close cooperation with medical clinical partners in Austria and Germany. And in 2018, finally, we got the official approval for treating also patients affected by Alzheimer's disease by smooth shockwaves, so-called transcranial pulse stimulation, so TPS for short.
Dr. Hazerao, explain exactly what Alzheimer's disease is. How does Alzheimer's dementia manifest itself, and why does the diagnosis cause so much anxiety for patients and their relatives?
Alzheimer's disease is the most common form of dementia, affecting around 60 to 70% of currently about 50 million dementia patients worldwide. Like Parkinson's disease, for example, it's a neurodegenerative disease. It is associated with a progressive degradation process in the brain, that is the loss of nerve cells and cell functions. The symptoms can vary depending on the patient and depending on the stage of the disease. Typical symptoms include memory loss, disorientation, problems in speaking, difficulties in performing daily life activities, and also personality changes. The symptoms increase as the diseases progress with corresponding consequences. Everyday life activity can no longer be done by the patients. They become more and more dependent on support from others until they often become expensive nursing cases. And this is always a difficult burden for the family members, of course.
You speak of progressive Alzheimer's disease, which can still not be cured.
Unfortunately correct. There is currently no treatment or medication that can completely stop the progression of the disease, but the symptoms can be treated. The earlier, the better, of course. With a good treatment plan, a significant improvement in quality of life for the patients can be achieved. Treatment is about maintaining mental capacity for as long as possible. The goal is to alleviate behavioral problems and promote independence of the patients so that they can perform their daily activities such as eating or dressing by themselves. It's important that the patients can actively participate in life and that the caregivers are relieved. And as I already mentioned, it's important to start the therapy as early as possible.
What therapies are currently used to treat Alzheimer's patients?
There are various medications that has to be taken permanently. A great deal of research is being done in this area, and there is also some progress and reports about new drugs that could slow down the progression of the disease in its early stage. So this gives, of course, is a cause for hope for many patients and their relatives. However, the benefits and above all the severe side effects which may occur have to be weighted up very well before possible approval. So in addition to the drug therapy, there is a whole range of non-drug therapies which can also help the patients and their relatives. For example, behavioral therapy, memory training, occupational therapy, physiotherapy, ergotherapy, and music therapy.
One of the non-drug procedures is transcranial pulse stimulation, or TPS for short, about which we would like to talk to you today. Most of our viewers have probably not heard of it, so what is it, TPS?
TPS is transcranial pulse stimulation. It's a non-invasive procedure that can be used in addition to standard therapy for mild to moderate Alzheimer's disease. So it's not a replacement for the standard therapies, it's an additional pillar in the treatment plan. TPS took more than 20 years to develop, and since 2018 it has been CE approved in the European community for the treatment of patients with Alzheimer's dementia. And it has been used already in more than 150 clinics and hospitals worldwide. Thousands of patients have been treated successfully with TPS. So what happened in TPS, we have smooth, low-energy shock waves, so-called TPS pulses, are generated in a special device called Neurolith. And they are delivered in a focused way, non-invasively, to the skull cap of the patient, to the brain tissue. And so the brain tissue is stimulated deep, up to 8 centimeters, and the blood circulation is considerably improved in this way, and it is also a painless process. So TPS is painless, is drug-free, and is a non-invasive procedure.
What can patients expect? Many patients certainly have some fears when they hear that their brain is to be treated with the shock waves.
In daily practice, it can be seen that patients and their relatives are amazed about the simplicity of the treatment of TPS, and that any fears are actually not justified. TPS is performed on an outpatient basis. That means that the patient can continue their daily routine life just normal after the TPS treatment. During TPS treatment, the patient sits in a chair and is free to move. Prior TPS treatment, the physician feeds the MRI images of the patient into the system, and the patient put on special glasses with integrated lenses, and a short calibration procedure is performed in order to match the head shape to the MRI images. Then the physician moves gently the therapy handpiece over the skull of the patient, non-invasively, and the transmitted energy is visualized via an integrated monitoring system on the monitor, so the patients and their relatives can see which brain areas are being treated right now, and this is pretty exciting also for the patients.
How long does a single session take, and how many treatments have to be performed?
A single TPS session takes about 30 minutes. In total, a TPS treatment series comprises in average 6 sessions, which takes place within 2 weeks. Furthermore, since Alzheimer's disease is a progressive disease, single follow-up treatments or session treatments are recommended every 4 to 8 weeks, but this is very dependent on the condition of the patient and on the stage of the disease.
And how well is TPS tolerated? Are there any side effects?
TPS treatment is usually very well tolerated. Some patients may experience temporary some side effects like headache or tiredness, but this is just temporary and it disappears after a few hours. In over 5,000 patients treated so far with TPS worldwide, no other side effects could be observed.
Does TPS work?
About 80% of patients with mild to moderate Alzheimer's disease report about real improvements of symptoms and improved cognitive conditions after TPS treatment. In addition, TPS is being continuously investigated at several research centers worldwide, in Germany, in Austria, in Hong Kong, and also in Italy. In multiple studies and observations published so far, significant improvement in the symptoms could be documented. So it has been shown that significant improvement in the cognitive abilities and in the memory functions of the patients could be achieved, but also a significant improvement in the depressive symptoms of the patients. And this is an amazing positive side effect on top for the patients. Data recently published from the University of Düsseldorf in Germany also came up with the same conclusion. So, of course, increasing number of patients and increasing more clinical studies and data are required in order to confirm but also manifest the positive achievements of TPS which are achieved so far. But we expect that TPS will soon have a fixed place in Alzheimer's disease, and with each additional study on the effects of TPS, we can make more exact statements about the TPS treatment.
Let's take a look into the future, Mr. Saccucci. In your opinion, will TPS also be used for other neurological diseases?
Indeed, TPS, transcranial pulse stimulation, is only CE approved for the treatment of Alzheimer's dementia. But let's say like this, the success that we have achieved so far is giving us the impression that, of course, we could be successful in other disciplines and the neurological field as well. Let's say that so far, any studies are going to be conducted, and we think that we could have some other potential in treatments of, for example, Parkinson's disease, attention disorder or hyperactivity disease, in depression, autism, mild cognitive impairment. So, let's say, of course, this is delegated to researchers to see if we can have indeed effectiveness in this respect. But as I said, any studies are going on, so we'll see in the next future which kind of surprises we could have. But of course, we believe.
Finally, what makes Storz Medical so special?
Difficult to answer, but maybe I can say this. I would say that the key of success, which could be valid for all companies, is first of all consistent teamwork. And the second, which is I think making this company quite unique, is the investment we are doing every year in research. I mean, this is really characterizing somehow our company as something unique, and I would say that 10% of our total turnover is always dedicated to research every year. So this is quite impressive, I would say. At least this is my opinion.
Dr. Hazarao, Mr. Saccucci, thank you very much for being with us today and informing us about your company and this new TPS procedure.
Thank you very much for the invitation.
Thank you for coming, it was a pleasure.
Se volete farci conoscere la vostra realtà imprenditoriale, scrivete a redazione@business24tv.it. Mi raccomando, non mancate, io vi aspetto.